I'm Dr. Arash Rafii Tabrizi. I'm a gynecology oncology surgeon, and at Cornell I run a research lab focused on ovarian and breast cancer. So the biggest issue now is treatment regimens have really been standardized, and we kind of are able now to treat most of the patient when we diagnose cancer, especially at early stage, for example, due to breast cancer screening programs. However, the issue is when patients do actually relapse, and for patients who develop relapses or metastases, at this point there's absolutely no solution that can be offered to cure them. So the challenge of the next 10 years is to actually tackle what we call the residual disease or the relapse disease, so the few cells that are left after primary treatment and that are going to be responsible for the disease to come back. So that's a very complex and interesting question, and there's a lot of buzz about like preventive diets and things like that. Up to date in terms of women cancer, so ovarian, breast, there's absolutely no proof that any specific diet could prevent cancer from happening. For breast cancer, obviously the best strategy is to follow a very strict screening program by doing mammogram and ultrasound on a regular basis. For ovarian cancer, unfortunately, there's no screening. For cervical cancer, women should perform regular pap smear. The rest, is common sense, like a healthy lifestyle, but it's not that a certain type of diet would prevent cancer from happening. Most of these are due to stochastic genetic changes and mutations occurring in cells, and unfortunately there is nothing known today that can help you preventing it. It's very, very low. It's an interesting question in terms of it's very low, but usually when a male displays breast cancer, it should be a red flag for the family, as it probably has some genetic causes. And now everybody's familiar with what we call the Angelina Jolie syndrome, where she got surgery to remove her breast and ovaries. That's an emerging field in cancer, which is knowing the genetic predisposition to cancer. So BRCA1 and 2 are the genes that are related to ovarian and breast cancer. And if you have a male relative, even a grandfather who had a breast cancer, that's a very strong indicator that your family might have a mutation, and then you seek the advice of a genetic counselor to see whether you qualify for genetic testing and then the subsequent different follow-up than the normal patient. As a gynecologic surgeon, what I see is really that people jump within a second from being a healthy person to somebody with a unfortunately deadly disease. And looking at this like 20 years of practice, I've unfortunately seen families being destroyed by this terrible disease, by cancer, and rebuilt. So I think that every moment of life is precious, and that you should really embrace the positive. We all have difficulties in our job environment, in our families, and I think everybody should just fight to make good things happen around themselves and really focus on the positive aspects rather than negative that are around us, and try to build a better place to live all together. And one big aspect of that today is to really take care of your health, and whatever you do will ultimately impact your family and the people that love you, and you should put your health first.